Okay, so this is the Mom Assessment CPE. So what I would do is I would wash my hands before going to the room. I would knock on the door, provide privacy, um, introduce myself. I would identify the patient. I would ask her name and date of birth, check it with the wristband. I would ask her if she has any allergies, and I would explain to her that I'm in there to just do a physical assessment for postpartum, and I'd ask her if that's okay. Um, then I would sit down with her so she knows I'm not in a rush to leave the room. So I would first ask her about her delivery, how it was, did she have any complications? I'd ask her if she's breastfeeding or bottle feeding the baby. I'd ask her if the baby is eating good, has he or she, um, has the baby passed a bowel movement yet, and what it looked like, because that'll help for the baby assessment, so I can already check that off. And for urine as well, I'd ask about if the baby has voided yet and what that looks like. I'd even ask what the baby's name is, so I seem interested in with her. And then I would ask her what her last void or last BM looked like. Is she voiding or anything? Is she having any issues with that? And if she says she hasn't had a bowel movement, I would let her know that I would teach her my first teaching point that that's normal postpartum. It could be a few days before she has her first bowel movement, so that's okay. Um, then I would ask her if she's in pain or if she needs anything at this moment before I go ahead and start touching her for her physical assessment. And once she says no, if she says no, then I can go ahead and move along and I can start with my physical assessment. So I put gloves on. I'll go ahead and put my gloves on. And I will first check her boobs. I'll palpate the sides just very lightly, and that's it. Nothing else. And then I would observe her nipples to check if they're inverted and intact. That's good. If she is breastfeeding, I would teach her that she needs to be wearing a bra in between her feedings. And if she's bottle feeding, she needs to be wearing a bra all the time to slow down that lactation process. Then I would check her abdomen. I would make sure that the fundus is midline. I'd also listen to bowel sounds at this point. And then if she had a C-section, that's the word I'm looking for. C-section, I would inspect the suture lines to make sure that it's approximated, no infection, any drainage or anything like that. And then I would check the fundus. So if we can see this here, I would cut my top hand on the top of the uterus and then cup the bladder at the bottom, and that checks the fundus. She would need to have her legs out and her head flat back when I go to do this. And you can palpate the bladder too, for distension and tenderness. If before the fundus check, she would need to have her bladder empty though, so if you feel distension, she would need to empty that before you do the fundus check. I would also monitor for the lochia, so the bleeding, the color of the blood, the amount of blood. If she saturates a pad in an hour, that's not good, so we need to let her be aware of that she needs to call the doctor, let us know if she's bleeding that much. Also, there shouldn't be an odor with that. Next, I would flip her over onto her side. If she had an epidural, I would inspect the epidural site for any edema, redness, infection, anything like that. While I'm back there, I'd also check for hemorrhoids and check the episiotomy site if there is one, again, for infection, redness, swelling, even bleeding, anything like that, the drainage. If she does have hemorrhoids present, I would need to teach her that a sitz bath and a warm compress will help those, and it'll take some time for those to go away. I'm going to take my gloves off after that because I just got done touching nasty parts of her body, so take gloves off and sanitize, rewash my hands, and then I would continue to assess, I would check the pedal pulses. So I don't know how else to show this. So I would do the top of the foot right here, and then the back of the foot right here. For the pulses for the strength and the rate, and make sure it's even on both sides. And then I would check and feel her legs for edema, especially her legs. You could feel other parts of her body for that, but mainly her legs. While I'm down at her feet, I would check for a Homan sign, which is where you push the foot forward, and if she has pain in her shin, that's a positive Homan sign. And then there's also you test for clonus, which is where you'd roll the foot. You do this on both sides, but you'd roll the foot around and then pull it forward. And if it snaps back, that's a positive clonus, which would mean she has neuroirritability, which could mean there's blood clots and stuff like that. So that's why we test for the clonus. And then at this point, the assessment is pretty much done with the mom. So I'd ask her if she needs anything else. And if not, I'd wash my hands. I could also, before leaving the room, it might not be a bad idea to teach her about the baby blues, because 1 to 4 days postpartum, it's normal for her to feel like she has mood swings, really moody. Just let her know that that's completely normal postpartum and not to freak out about that. But the assessment would be done, and I would leave the room and document.